Joining me now is Democratic Congressman Anthony Weiner of New York. Congressman Weiner, thank you for joining us.
Thanks for having me. Appreciate it.
So, are liberals in the House willing to kill this bill if it doesn't have a real public option, not a fake public option like a trigger or an opt-in or one of those kinds of things, but a real strong public option?
Well, one of the things to keep in mind here is many of us have already compromised a long way. People like me wanted to have a single-payer system, Medicare for all Americans. We compromised to a strong public option for a very small number of people, the people in the exchange. We're perilously close to negotiating away too much for progressives in the House, or frankly, most people. You know, the thing that's most complicated to all of us is we listen to our colleagues in the Senate say it doesn't save enough money. And then the one tool that we have, or one of the tools, the public option, they say we want that added there too. The problem with these negotiations is we do have a small group of Democrats who are arguing essentially an inconsistent thing. They want lower cost, which the public option can provide, but they don't want the public option.
So how did we sink to this incredibly low point in this debate where there's not even any mention of a single-payer system, even though about 50 million Americans are already in a single-payer system? That's called Medicare for people over 65. And another 25 million Americans are in a socialized government-run healthcare system called the Veterans Administration, which also happens to be the most highly rated of all the healthcare systems in the country, both private and public.
Well,
how did we get to this point?
Well, not to mention the Department of Defense, which is also single-payer government, and the Bureau of Indian Affairs. We do it a lot of cases.
Not to mention the 535 congressmen who have sort of a hybrid system.
Well, we have a hybrid system. Yeah. We have essentially our own public option, many of us, because we're on Medicare. Right. I mean, not myself, but there are a lot of members. I did a survey and checked 150 members of the House and Senate are on a public option Medicare. But here's first of all, let's not get too carried away with this whole notion how far we've sunk. It's still a good bill.
The House bill was great.
Well, look, great. I mean, it too was a compromise for many of us.
But very solid.
Yes, but the Senate bill, I think, still, and we have a conference to get to. Look, one of the things that I've argued all along is that if we knew what people like Senator Lieberman or Senator Landrieu or Senator Lincoln, if they said, look, here are the things we want cost savings, we can give them cost savings. We can have a stronger public option which negotiates to hold down prices, maybe do what Ron Wyden wants, which is let everyone go into the public option. We can take something like the Medicare system, which has a 1.5% overhead, and expand it to more Americans. We can do cost savings. But we have to know what they want. And between the public option getting watered down and the Stupak amendment attacking the rights of women, and by the way, putting government bureaucrats between people and their doctor, if those things stay intact, I don't think this has the votes to pass the House. And that's regrettable because there are a lot of things that we can do that we all agree on.
What about Bernie Sanders' idea that he was talking about earlier, which is if you can't pass this thing, don't try to reform the whole system, expand Medicaid, put in some money for federally qualified health care centers and those kinds of things?
You know, I don't buy, and Bernie's great, but I don't buy the idea that we're transforming health care with this. I kind of wish we were. For the most part, it's right. A lot of people are going to keep the insurance that they have. We're going to add some new standards, and we're going to give some tax credits to people to buy insurance. But what we really should be thinking about doing is taking something that works, and by the way, is a bedrock Democratic program, the Medicare program, and expanding it to more Americans. Everyone understands Medicare because their parent or grandparent is on it and they like it. We've made some strategic mistakes, I believe. All that being said, where we are is that if we Democrats think we're going to stand for re-election in 2010, having a watered-down public option or none, and having the Stupak language in there, we're going to find we might be doing more harm than good to our brand.
Well, that's what I want to ask you about. That'll be the last question for me. More harm than good. At what point is this bill not worth passing?
Well, it's interesting.
And we have the votes to make sure that make that stick.
It's a good question. I have this website, countdowntohealthcare.com, where I let people kind of weigh in each day. It started out focusing on Republicans. Now it's focusing entirely on Democrats. We have to realize we're getting very close to a point that we were in the summer where the American people desperately want us to fight back and stand for principle, and we're not doing it. I'm convinced that Senator Reid and Chuck Schumer and Ron Wyden and people like Bernie Sanders are going to finally bring around those recalcitrant senators. But if we keep watering this down much further, we're getting close to that point. But we don't want to let the perfect be the enemy of the good, but it's got to at least be the good at the end of the day.
But at some point, this is just, as Ross Perot once said, a giant sucking sound pulling American taxpayer money into the insurance companies, and we don't get anything for it.
Well, there's three things we needed to do: provide insurance for people that didn't have it, provide better care for people that have insurance. But that third thing, cost savings, the public option is how you do that. And we're starting to increasingly think that by throwing that overboard, we're going to pass the bill. That's a bad calculation to make. We need the public option.
Congressman Anthony Weiner, thanks so much for taking the time.
Appreciate it.
Appreciate it.
My pleasure.